Alright, we're recording. First up, we have the biceps femoris.
Here it is.
The origin point is the ischial tuberosity and linear aspera of the femur. Go up to the linear, or the ischial tuberosity.
Okay, so it's going to be on the inferior, posterior part, I mean.
The insertion point is the head of the fibula and lateral condyle of the tibula. The action is flexion at knee and extension and lateral rotation at the hip, innervated by sciatic nerve, tibial portions S1 through S3, and common fibular branch L5 through S2. Also, so next up we're going to have the semimembranous.
Where's the gracialis? It shows it on the other side.
The semimembranous, the origin is the ischial tuberosity. The insertion point is the posterior surface of the medial condyle of the tibia.
Point of origin is
all the way down there. Medial, yeah, it could be around in that area. The action is flexion at knee, extension and medial rotation at the hip. Innervated by the sciatic nerve, tibial portion L5 through S2. The semitendinous. Connected.
Okay, inferior ramus of the pubis, posterior.
The origin point is the ischial tuberosity. The insertion point is the proximal medial surface of the tibia near the insertion of the gracilis. Keep going.
Still 5 and S1, there's only 2.
Right there.
Right. 5.
Okay. It's innervated by sciatic nerve, tibial portion L5 through S2. The sartorius.
Okay, so there's the pubic symphysis, and it's more this way.
Originates at the anterior superior iliac spine.
So it's abductor longus, gracialis magnus.
The insertion point is the medial surface of the tibia near the tibial tuberosity.
Okay, and this is the abductor longus, so it's got to be
Yep. The action is flexion at the knee, abduction, flexion, and lateral rotation at the hip. Innervated by femoral nerve L2 through L3. The rectus femoris.
right here.
The origin point is the anterior inferior iliac spine and the superior acetabular rim of the ilium.
Yeah, the insertion is the.
The insertion point is the tibial tuberosity via the quadriceps, tendon, patella, and patellar ligaments.
Okay.
The action is extension at the knee, flexion at the hip, innervated by femoral nerve L2 through L4. We'll go ahead and do the intermedius. The vastus intermedius is a deep muscle. Originates at the anterior lateral surface of the femur and the linear aspera, the distal half. Actually wraps around the femur.
Okay, where are you?
So it kind of
Extends
the wrap point there,
Okay, anterior
where it's going to the
surface
back. The insertion point is the tibial tuberosity via the quadriceps, tendon, patella, and patellar ligaments. The action is extension at the knee, and it's also innervated by femoral nerve L2 through L4. The vastus lateralis.
Okay.
The origin and point is the anterior and inferior to greater trochanter of the femur, along the linear aspera, and along the proximal half.
Okay.
The insertion point is also the tibial tuberosity via the quadriceps tendon, patella, and patellar ligaments. The action is extension at the knee. It's also innervated by femoral nerve L2 through L4. The vastus medialis. The origin point is the entire length of the linea aspera of the femur.
Abduction and
It's a wraparound muscle as well. The insertion point is also the tibial tuberosity via the quadriceps tendon, patella, and patellar ligaments. The action is extension at the knee. It's also innervated by femoral nerve L2 through L4.
No, I can't tell. No, the other. I got it.